The system does not teach doctors to be critical thinkers. They want robotic protocol followers. And this is when these players can come in from the pharmaceutical industry and take advantage of what I call a useful idiot mindset. Many doctors are. They're useful idiots to help corporate interests make a ton of money.
I was tagged in this video and I thought it was interesting to watch, definitely very inflammatory. I think what's really important to clarify with doctors and this, as he puts it, useful idiots, we are becoming much more regulated in how we approach medicine, and that there are a lot more protocols and there are a lot more flowcharts in terms of how you treat a patient and what medicine you give a patient or what procedure you do for a patient. But a lot of that is out of necessity because medicine is becoming so much more complicated. We're learning so much more about different diseases. We're learning that different diseases exist that we didn't know about before. The amount of information is overwhelming, and it's not enough to just rely on a doctor's intuition and their prior experience. Treating all the different diseases that we now know about is really nuanced. And we need guidelines to help us at least get started in treating these patients with these diseases. But I don't think that automatically makes us useful idiots, because there's still a lot of nuance that's involved in even following these protocols or these guidelines. It's very rare for a patient to perfectly fit into a protocol or perfectly fit into a guideline, but it helps us make sure that we're sticking with evidence-based medicine. This means making decisions based off of studies and research that have been done so that we're treating patients in the best way possible. But it's still up to the doctor to know which protocol to use or what to do when their patient kind of fits into both sides or fits into neither side of a flowchart, for example. And that's where the MD degree comes into play. We use our prior experience, we use our training to make that decision and decide how to alter a protocol or how to fit someone into a guideline that doesn't really fit. And to suggest that we're doing this to please corporate entities or to make more money for corporate entities, I'm not really sure what that even means. Because even if you're not following guidelines or protocols, you're still usually going to be giving patients pills or medicines or procedures to treat them. It's just a matter of if you're doing it in the most evidence-based way. So I'm not sure why following a guideline that's evidence-based is benefiting a corporate entity. It's true, often guidelines recommend giving medications, but medications are often the best way we have of treating diseases. And if I'm just going with my gut and trying to fix someone's high blood pressure or trying to treat someone's H. pylori infection, I'm going to still use medicines whether or not I'm following this protocol that's been carefully constructed or just using what my intuition suggests based on my training. I don't think doctors are just following a cookbook, so to speak. We're not just putting in numbers and taking whatever comes out and giving that to the patient. There's nuance to it. And that's honestly what's been really frustrating for me over the course of my medical training, because I thought medicine was just following steps in a cookbook or a recipe in order to give the patient the treatment that they needed. But it's not that easy. We need all this medical training to know what to do when the patient doesn't fit that book perfectly. And unfortunately, that happens with pretty much every patient. So I think useful idiots is a misnomer, to put it mildly, and a ploy to get views, to put it generously.